There we go. Good morning. Sorry, good afternoon, rather. Brendan will brief on behalf of the PJ right after we're done with our guests. I have a senior appointment to announce. Following consultations with the Executive Board of the UN Population Fund, the Secretary General has appointed NATALIA KANEM of Panama as UNFPA's new Executive Director. She succeeds the late Dr. Babatunde. A champion of life and dignity for all, Dr. Babatunde was admired globally for his leadership of UNFPA and for his immense and invaluable advocacy for the world's women and girls. Dr. KANEM brings to the position more than 3 decades of strategic leadership and management in the field of medicine, public health, international peace and development, human rights, and social justice. She currently serves as the acting executive director of UNFPA. Prior to that, she was the deputy executive director for programs at UNFPA, and earlier the UNFPA representative in Tanzania. Her full biography is in my office, and we congratulate her. Turning to the situation with the Rohingyas, the UN Office for the Coordination of Humanitarian Affairs says the number of Rohingya refugees who fled into Bangladesh from Myanmar has now reached 509,000 people. Yesterday, the figure was at 507,000. Emergency Relief Coordinator Mark Lowcock and UNICEF's Executive Director Anthony Lake continued their visit to Bangladesh, speaking to reporters in Cox's Bazar. They called for urgent funding to scale up the response. The Emergency Relief Coordinator noted the horrific living conditions of the refugees, stressing the need to ensure the current tragedy does not become a catastrophe with the outbreak of disease. He announced an additional $12 million from the Central Emergency Response Fund, the second allocation this month to respond to the crisis. OCHA says the total number of land now occupied by refugees is 9.6 million square meters, the equivalent of 889 football fields. I don't know if it's European or American football, but it's a large number. UNHCR, together with Bangladeshi authorities and other partners, are working to contain an outbreak of diarrheal disease, with nearly 4,800 cases have been reported the past week. Diarrhea Treatment Center opened yesterday in the Kutupalong refugee camp, where refugees have been living since 1992, have taken in thousands of newcomers. By the end of this week, there will be a total of 80 beds in diarrhea treatment centers in 3 locations, with 2 more centers planned to open next week. UNHCR staff, along with refugee volunteers, will fan out to refugee camps and informal settlements to find people who may be sick but have not sought treatment. UNHCR is also supporting efforts by the Ministry of Health of Bangladesh to administer vaccinations for cholera, which is endemic to Bangladesh. And as you will have seen yesterday, we issued a statement on Cameroon in which the Secretary General said he remained deeply concerned about the situation in Cameroon and strongly condemns the acts of violence reported in the southwest and northwest region of the country on October 1st, including reported loss of life. He calls on Cameroonian authorities to investigate these incidents and urges political leaders on both sides to appeal to their followers to refrain from any further acts of violence and to unequivocally condemn all actions that undermine the peace, stability, and unity of the country. The Secretary General takes note of the calls by authorities for dialogue and encourages representatives of the Anglophone community to seize the opportunity in their quest for solutions to the community's grievance within the framework of the Cameroonian Constitution. He reiterates the support for the for the United Nations for such efforts through the UN Regional Office to Central Africa. And our colleagues at the UN Peacekeeping Mission in South Sudan tell us they have received reports of fighting in WAAT town in Jonglei between the Sudan People's Liberation Army and the Sudan People's Liberation Army in opposition and youth belonging to the Lu Nuer tribe. The mission is concerned by the large number of reported casualties and is trying to gain access to the area. It calls on all sides to immediately halt hostilities and reiterates the need for an inclusive political solution to end the crisis. And we have been asked in recent days about our efforts to deal with the authorities in Baghdad and Erbil and I can say that we welcome the efforts to resolve the issues between Baghdad and Erbil based on the constitution, notably the intervention of religious authority Ayatollah al-Sistani last Friday that urged respect for the constitution and the Supreme Federal Court's decision as regards to referendum. We also welcome other initiatives to resolve the crisis within the constitutional framework and in full respect of Iraq's unity, sovereignty, and territorial integrity, and to restart dialogue and cooperation between Baghdad and Erbil on this basis. The UN mission in Iraq is carefully monitoring the impact of the administrative, legal, economic, and diplomatic steps and measures introduced by the federal government in discharge of its prerogatives, rights, and responsibilities according to the Constitution. The UN in Iraq urges both sides to start technical negotiations on how to implement them in the spirit of partnership. We take note of the pledges of the government of Iraq to preserve and respect the interests of all its citizens, including the Kurdistan region, and the confirmation that the measures are not intended to prevent travel of the people and arrival of supplies, or to punish people or to impose sanctions, but that they are for controlling the entry and exit of people and goods into the region and putting it under the control of the federal government and federal authorities. We continue to call for calm, restraint, and strongly call on all sides to avoid statements, public announcements, or steps that could raise racial or sectarian tensions that could further inflame the situation and pave way towards escalation. And our colleague Nikolai Bladon, the Special Coordinator for the Middle East Peace Process, was today in Gaza, where he met with the Prime Minister of the Palestinian Authority, Rami Hamdallah. Afterwards, he said he was encouraged by the firm commitment of President Abbas and the government to return to Gaza under the full control of the legitimate Palestinian Authority. This is essential for resolving the humanitarian situation as soon as possible, most notably the crippling electricity and health crises, and should facilitate the lifting of movements and access to restrictions on Gaza in line with Security Council Resolution 1860. He added that he is encouraged by the continuing engagement of Egypt with all sides to ensure the implementation of the Cairo understandings. The United Nations stands ready to continue working with the legitimate Palestinian authorities and the region in support of the government in taking up its responsibilities in Gaza. And UNHCR says it's becoming increasingly concerned over funding situation for refugees and other displaced families in the Middle East, where currently only a quarter of families are likely to receive adequate support to prepare for the approaching winter. There are nearly 15 million Syrian and Iraqi refugees and internally displaced people scattered across the region. UNHCR estimates that as many as 4 million are in the extreme risk category and need timely and substantial help to prepare for the forthcoming winter. Of these, only 1 in 4 is likely to get assistance in need. The $245 million regional winter assistance plan for the region is only 26% funded. And UNHCR also tells us that they are concerned of the growing violence in parts of the southeastern DRC, which has driven some 3,000 refugees into northern Zambia since August 30th. This is the largest influx of Congolese refugees into Zambia in the past 5 years. And the Global Task Force on Cholera Control, the GTFCC, will launch a new strategy tomorrow to reduce deaths from cholera by 90% in 2030. Cholera kills an estimated 95,000 people and affects 2.9 million people every day. The new plan, Ending Cholera, the Global Roadmap to 2030, recognizes that cholera spreads in endemic hotspots where predictable outbreaks of the disease occur year after year. And tomorrow there will be a press briefing. Tomorrow the Secretary General will brief you at 10:30 at the Security Council stakeout on countries impacted by the recent hurricane, and that will probably be in lieu of a noon briefing, so that's 10:30. And on that note, we have Stephen O'Malley, the UN Resident Coordinator for Barbados in the Eastern Caribbean, who will join us in a few minutes from Dominica. And then we'll have Brendan. But before that, I will take your questions. a solution needs to be found to those people, to those Rohingyas who currently have no status, whether that implies giving them nationality in Myanmar or giving them some sort of working papers. Yes, Edie.
Steph, could you give us an update on the Children in Armed Conflict report? When are we going to actually see it?
Soonish. I wish I could give you a more detailed update, but that's as detailed as I'm able to do right now. But I'd like to try to get some more information and more detailed so I can actually stop fielding those types of questions. Evelyn. And then.
Thank you, Steph. Every day, or today at least twice, you mentioned relief operations that are short of money. Is the SG in his reform plan somehow going to amalgamate it? And to add another one, yesterday I received an email from UNIMID saying that they can't fly food into Darfur because they don't have enough money to have their planes operated. If you have anything more on that.
No, that I will check.
Also, the aid thing goes on
well,
endlessly.
we know this has been a chronic issue. We are seeing a huge number of humanitarian needs. A lot of these crises are obviously things you can do contingency planning for, but the UN doesn't sit on a pile of cash. We have a central emergency fund which we disperse as needed, and we just did in the case of the Rohingyas in Bangladesh. But it is a recurring problem. Our humanitarian operations are voluntarily funded. Yes, ma'am.
Thank you, Stéphane. I was wondering if the SG has submitted his report on Cyprus to the Security Council. If not, when?
I don't know, and I will check.
Thank you.
Both. Yes, sir.
I want to ask on the brutal killings in Cameroon, English-speaking Cameroon. Eyewitness reports say that the authorities have entered homes and brutally killed up to 100 people. Of course, that's eyewitness reports on the ground. What is the role of the UN? Like, is not this the time for a special rapporteur to Cameroon rather than the cause for dialogue with this?
Well, obviously, you know, the issue of special rapporteurs is one that the Secretary General, that's outside of the authority of the Secretary General. I think we've had a number of diplomatic contacts at various levels with the Cameroonian authorities. We've expressed our concern at the ongoing situation, especially at the violence and at the loss of life that we've seen. We've seen that the authorities have called for dialogue, and we encourage those leaders in the Anglophone community to seize that opportunity. Yes, sir.
Yeah, there was this report by Human Rights Watch that around $137 million allocated for the education of the Syrian refugees in Lebanon have disappeared. Is there any investigation how that amount?
I haven't seen that report, but I will check. Okay.